I'm Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is neck rejuvenation, or how to stick your neck out, but more beautifully. So, one of the first areas of a lot of people aging process is the neck, the turkey gobbler. We see this often. Some people are born with that, but often it can occur as the first sign of facial aging. Why? It's the area that has some of the thinner skin on the face. It's often also where we don't put moisturizers, skin care. It also, the muscles there tend to separate and are weaker than other muscles of our body. So what are our options? Some are surgical and some are non-surgical. So let's talk with the non-surgical first. The non-surgical is going ahead and using Retin-A and hydroquinone to help shrink the skin. Now, if you have diet-resistant fat, we'll use minimal surgery, often done under local, where we make small little incisions behind the earlobe about the size of a pencil that we can put in the liposuction probe, and we liposuction the neck, and then we follow it with ThermiTite. What is ThermiTite? ThermiTite is a device that we insert after we liposuction. It invisibly emits radio frequency waves that shrinks the skin from underneath. It has a thermometer at the end, so we take it right up to the temperature to get the maximum shrinkage with no tissue damage. We also monitor the skin afterwards, so we can go ahead and make sure we get good shrinkage. Another way is doing Cabela. What is Cabela? Cabela is an injection that decreases the fat. So what we do is we inject the Cabela, which is the same enzymes that digest fat in our body from our gallbladder. We get the first layer of fat and we inject. You come back 3 to 4 weeks later. We do the second injection, gets the third layer of fat, and we do the third or fourth until we get the contour we would like. Obviously, where this fat occurs is genetically based. So this does not get fat that's under the muscle as such. Then we can go ahead and use radio frequency, ThermiSmooth, or our sublative radio frequency on the skin to tighten it externally. All, no downtime, in and out. Now, what happens if you have excess skin, separated muscle, and fat that we can't get rid of? Now we move to the minimally incision neck lift. That incision usually starts here under the earlobes, comes back underneath here, and where you see the two bands, we call these platysmal bands. And we go ahead and make a small incision here where we tighten the muscle like a corset. Now you have a streamlined neck, and then we gently lay the skin back. So we don't have the windblown look, but now you have a classic smooth looking neck. Now when we combine that with jowls and cheeks, we call that the facelift. So there are many options. Our mantra is one goal, many options. When we add non-invasive to surgery, we call that synergy. 1 + 1 does not equal 2, but 1 + 1 equals 4 or 5.